Good morning, Dr. Esri. It's Maria.
I am Rio and Eric.
Okay, and for our video today, we decided to do video number 4, which is resolving conflict to ensure patient safety. So for the first one, one of the scenarios of the ineffective communication and the outcome of this scenario between Rio and Alex. So I feel like the ineffective communication was that when Alex approached Rio, he approached her with a tone in his communication and how he stated his words. For example, on the first statement, when he said, "You didn't give an order," and another one, "Are you going to make the order or not?" He came across to her a little aggressive, and just the tone of his voice was not very friendly to use for his communication.
Yeah, so pretty much Alex, after that situation happened with Rio, he understood going home, like, that it wasn't right how he took his approach to talking to her about the situation with the insulin. So he thought about it, and the good thing is that he brought the problem up with Rio. So that's one of the main things that we need to do instead of letting problems get worse and not bring them up or to talk to that person about them. It can just affect workplace environment. So when he did have that conversation with Rio, he did use important communication strategies like using I statements as well as having bringing up shared interest. And in this case, it was letting Rio know that, you know what, the way that he acted was inappropriate and that all he cared about was making sure that the patient was getting treated properly and that that was his main goal. And he understands that she knows that that is also a goal of hers and that that he would like to work better in communicating with her to make that goal more achievable. And so through using those I statements, he understood, saying like pretty much, I should have came at you in a much more approachable way instead of blaming you or saying like, why didn't you do something? I should have taken the right steps to bring up a solution rather than trying to make it a bigger problem than it was.
Okay. So for the recommendations of what should have changed in our opinion, that he could have, even though he was frustrated, he still could have approached her differently. He could have told her, "Hey, our patient needs this," or "I need this," instead of telling her, "You didn't do this." Because if he knows that she's already a closed off person or dismissive, that he should take steps to prevent an argument from happening, from her being so dismissive. So he can tell her, "Hey, my patient needs this. I need this." He can tell her that, like he said, he can bring up the shared interest of the patient, shared interests, which is the well-being of the patient. For our use in school and in clinicals, we can take that into consideration, knowing that you get more by being like productive with the person rather than kind of pointing fingers. And a lot of people will take offense when you start telling them, "You didn't do this, you should have done this," instead of saying, "Hey, can we do this?" or "I need this," which is just as easy to say.
Yeah, yeah, so like pretty much like how I would use it too is exactly how Rio was talking about. And if there are situations where I do feel like a coworker does feel a certain type of way, I have to understand that as an individual, maybe something is happening in their life. So I can't just assume they're acting that way towards me because uh maybe they don't like me or something. I have to try to do my best to empathize with that person and to to empathize with that person and to maybe even like how Alex did bring up the problem if everything's okay or you know what, just to give that person space for a little bit or just to not make the situation worse.
And for me, I think that the open-ended question and also sharing interest with that person. Just basically, when you talk to that person, just give that person a chance to explain their self, and also to make yourself clear when you're communicating. If there's something that you needed help with, it's always good to have that open communication with each other so that other person knows what you need help with. And at the same time, you can also hear what things that you can improve from hearing it from the other person you're talking to.
So we researched the what was it?
The code of ethics.
The organizations that support and expect nurse civility.
It was the it was the International Council of Nurses Code of Ethics. So we looked through those, and there were, like, for example, Section 2.5 emphasizes that nurses are supposed to maintain standards of professional conduct at all times. So I'm assuming that they mean with the patients and also with your colleagues. They reflect well on their profession and enhance its image and public confidence. Because if a patient were present for an argument like that or like some kind of confrontation like that, it would definitely decrease the patient's confidence in our ability to treat them or just our ability to communicate in general, which is not a good look for us. We're supposed to enhance the image and public confidence rather than making them feel like we're not able to do our job smoothly and talk to each other like we should. Especially if it has something to do with the insulin, like they did, which is like a serious health concern for them. That's not a good look if we're just arguing about who's supposed to do it or who has more to do and who's responsible for doing it, rather than just saying, "Hey, we need to do this for the patient." It's at that point, it's not about patient safety. It's about who did what and who didn't do what, and that's more of an argument than like a workplace professional relationship, in my opinion.
Okay,
That's pretty good.
I think we agree.
All right.
Thank you.
Thank you.